Stephanie, a local doctor is using a machine that really sounds like it's out of the movies to help his patients look younger and feel more confident. There's only one Vectra system here in the tri-state. Facial plastic surgeon Dr. Alexander Donat has it, and he is here to show us how it works. Dr. Donat, good to see you.
Good to see you. Thanks for having me on.
So before this, when a patient came in and said, I'm thinking about a nose job, or that's probably not what you call it, plastic surgery on my nose, or some fillers in my cheeks or something, how were you able to show them what it would look like?
Yeah, frequently we had an imaging system that was two-dimensional, but with the new three-dimensional imaging system, we can truly rotate it all around.
Yeah, so before you would have like a side shot and a
Correct.
front shot, and that was more or less it,
That was
right?
it, and it was good, but it was not as excellent as this is.
Okay, so I actually came up to your office and we shot some video of this Vectra system, what it looks like and how it works. Show me, it has all of those cameras. Tell me how this works.
Yeah, so it has 6 different SLR cameras that will work together to create this three-dimensional image that you can then rotate. So it takes a lot of data, puts it together, and composes this three-dimensional image. That you can then rotate around. You can morph it. It's a very intelligent system, so it can take the image and tell you where a bump on the nose is and how much to bring it down. You know what millimeters that is. When you take it down, it can tell you how much volume you may be putting in when you're doing augmentation of the cheeks.
Okay.
And then rotating that in 3 dimensions. So.
Wow. So how does that help you as a doctor?
It mainly helps the communication process.
Okay.
I have a pretty good feel of how much volume I may want to put in, but it helps to show the patient what that might achieve.
Right.
And then gives them an opportunity to say, you know what, that's a little more than I wanted, or a little, you know, I don't see enough difference.
Probably
and so
gives them like a more realistic idea. Now, you also have a model who is an older woman.
Right.
And you started out with the 3D image, and then you made some changes on it. We have those images. I want to put them up on screen now.
Okay.
Tell me, first of all, when you look at the one on the left, that's the before picture.
Right.
What did you do with her?
The biggest thing is volume enhancement.
Okay.
And that's really the third dimension in facial rejuvenation is replacing the volume that we lose. We all know about lifting and cutting and removing excess skin, which we did to her neck in her jowl area, but really the volume augmentation of the cheeks, I think, and around the eyes makes a really profound difference. When you say volume
augmentation, what does that mean? You put something under her skin?
Absolutely.
Okay.
Yeah.
So we actually have some pictures that kind of show underneath the skin what that looks like. There's the more angular view. Right. What do you put under someone's skin?
Yeah, the best stuff is fat, your body's own fat.
Really?
It's rich
Where do you
in
get
stem
it?
cells. You get it from wherever you don't want it, put it to where you do.
Wow. So if I didn't like my thighs, would it take volume out of my thighs
Absolutely.
and put it in my cheeks?
We
It
could.
would.
Yes, yes. So it doesn't take a tremendous amount of volume to make a big difference in the face, but people love the fact that we can take it from where you don't.
And we have another photo that really shows where he put the fat, right?
Right, right. So this is just an example here of how the machine can tell us exactly how much volume we're putting in when we're doing the simulation with the 3D imager. So it can tell you that 5, 10 cc's of synthetic filler or fat.
It's that specific.
Yeah,
wow,
yeah.
That's pretty amazing. Yeah. Now, is a consultation free if somebody wants to come in and find out about this?
Yes.
And then they would pay for the surgery after that,
Whatever
right?
they might
Insurance doesn't usually cover plastic
not
surgery,
usually,
does
no.
it, Dr.
No,
Donat?
rare cases, yeah.
Okay.
Yeah.
It must make it much more reassuring for the patients, though, I would think.
Absolutely. As did the two-dimensional imaging system, the three-dimensional imaging system is just that much better in reassuring them about what they're going to get.
Wow. Well, thanks so much for coming in to talk to
My
us
pleasure.
about the men issue. What do you do many men? Rob says plastic surgery never looks good on men. Do you disagree?
I agree with the assessment that men can look odd if you do certain things. The biggest thing is the brow lift. So Rob, you're right on, but the brow lift is on a guy. It's very easy to look unnatural and feminine on a guy.
Okay.
And too much skin from the upper lids. So we've got pictures on our website, cincyfacialplastics.com, that hopefully can show some natural results.
Yeah, and that's what you're striving for.
Absolutely. Yes.
We have the link at fox19.com. Just look in the big red box. I put it in there this morning. Dr. Donat, thanks so much.
My pleasure.
That was
Thank
really
you.
interesting. We'll be back.